Sonavex is a Baltimore-based medical device company spun out from Johns Hopkins. The company is dedicated to creating novel and automated ultrasound technologies, which empower clinicians to deliver superior patient care and savings to the healthcare system. Sonavex has two FDA-cleared technologies, EchoMark and EchoSure, with additional pipeline products in development. One key application for the technology is to improve care for kidney failure patients. Beyond substantial clinical challenges, Medicare spends $36 billion each year on this population. For the roughly 5 million patients expected to require hemodialysis by 2025, a functioning vascular access is literally their lifeline. A surgically created AV fistula is the preferred form of access. However, 80% of hemodialysis patients begin dialysis with a central venous catheter, despite the high risk for bloodstream infections, costly hospitalizations, and even death. To eliminate the catheter, the fistula must undergo a natural process called maturation, whereby the fistula expands in diameter to accommodate high volumetric flow to support dialysis and enable cannulation with dialysis needles. However, 30 to 50% of fistulas fail to mature. And for those that do mature, maintaining functionality or patency is a challenge. In the current paradigm, time to maturation for surgically created fistulas is lengthy, resulting in substantial catheter contact time. In fact, studies have shown that 85% of patients who initiate dialysis on a catheter continue to rely on a catheter 3 months after starting dialysis, and more than half remain on a catheter at 6 months. In addition to the elevated risk for hospitalization and mortality, the incremental cost for a catheter exceeds $160 per patient per day. A top priority for the renal care team is getting patients on a functioning permanent access and no longer dependent on a central venous catheter. Every day counts. Early and routine ultrasound readings enable providers to take action to use the fistula, intervene on an inadequate fistula, or create a new access for patients with a failing fistula. Early decision-making, regardless of treatment path, will result in reduced catheter contact time. Ultrasound criteria, specifically volumetric flow rate, diameter, and depth, have been established to assess the status of fistula maturation as early as 2 weeks post-op. Unfortunately, ultrasound information is not available in the dialysis clinic due to the need for specialized training, and therefore requires separate visits to a dedicated lab. However, access to this information is limited by poor patient compliance with appointments outside of their dialysis sessions. The EchoMark resorbable implant and EchoSure automated 3D ultrasound are designed to enable any member of the care team to rapidly collect quantitative blood flow data in any clinical setting without a separate appointment or referral, resulting in significant clinical and economic value. Sonavex, empowered patient care.